Welcome everyone. This is our back bridge workout. So the back bridge will always have a special place in my heart because it's the workout or the skill that I was most scared of. I was terrified of a back extension. I thought everything had to be very neutral, core braced, perfect hinge. And as I kept doing it, I started to notice some pretty profound results, and it's still a long-term goal of mine to have a really nice looking back bridge. So I'm excited to show you this one. Now remember, even if you don't have back issues, have never had back issues, maybe your pain and dysfunction is elsewhere, shoulders, knees, whatever, all of these positions have benefits throughout the entire body. So I'm just using myself as an example. So we're going to start with a 9D. Remember, that means 9 minutes continuous. And in this scenario, we're doing 3 different exercises 3 times. So the first one is our foundation hold. So as the video shows, knees slightly bent, chest tall, arms out in front of you, and push your hips away from your hands. And you're gonna hold this and just keep emphasizing that. Hips away from hands, chest tall, and you're gonna hold that. And you'll be amazed how much engagement, how much fatigue you feel up your entire back. So you'll notice this pattern at the start of every single one of our workouts. It's minimum movement, really, maximum blood flow, and that is intentional. Now we're going to pair that with band pull downs. So all you need for this is a band. It doesn't have to be a thick one. Any band will do. And partial means you're just doing partial pull downs. So really they don't have to be perfect by any means. You're just doing partial pull downs because, again, our goal here is simply blood flow. Lots and lots of blood flow to get things ready. And then the third one is a plank. And this says easy, meaning you want to pick an easy variation for yourself. So for some people, this will be difficult. Other people, this will be difficult. Importantly though, notice shoulders behind elbows. And now you're just going to hold that for the recommended time. Again, lots of blood flow. So now we're going to move into, once you complete that, some of the loaded stretches. But we're just going to ease into this. Remember, the range will increase as we go. But now we want to start to think about our tension, pain, and progress. So the first one here, don't mind these big ones. They're here for an upcoming exercise. Pullovers first. So here you should have tension in your bum, hips up high, and then reach away, and you're never relaxing. So that's the tension. You're never relaxing. The pain, you're just going as low as your body will allow. And then progress. You could progress by going lower or adding more weight. Now, if that's too much, reduce the weight and lay the other way across the bench. Now you could do this on a chair with some cushion, even a Swiss ball, so there's lots of options. And then we're going to do half Jefferson curls. So I like to use a wall reference here, which just means you're going to push your hips against the wall, slight knee bend, and then tuck your pelvis. That's important. Slight knee bend, tuck your pelvis. And now just imagine curling forward one vertebrae at a time. So again, tension the whole time, pain, of course. I had to be careful with this one when I first started. Start body weight if you need to, go easy. And then progress, you just wouldn't go as low, right? So for some people, even this right here will be enough. Is just bring chest down, and you will notice over time you can get lower and lower. And then the third one, before we get into the bridge work, is some sit-ups. Now I have Swiss ball sit-ups written. I'll show you those in a moment. You can do these on a bench. You just need, no matter which option you're doing, you need to anchor your feet and then think about mimicking that half Jefferson curl, but obviously now the tension's going to be elsewhere. So Jefferson curl, we curled forward. Now we're going to unwind, but still same thing. Imagine one vertebrae at a time and just as low as you can go. If you can only go to here, totally fine. And then over time, you're trying to get that stretch in here, but maintain tension. So like I said, you could do this on a Swiss ball. You just need to still anchor your feet. And now, last but certainly not least, we get to the bridge progressions. So option one would be an easier option. This is definitely where I started. You ideally will have a wall for this. Tension here is bum, hips forward. And you can start just by reaching to the wall. So reach with one arm, touch the other one if you can. You can go the other way and just go back and forth. So that'll be enough for lots of people. I mean, I still get a lot out of that. And progress here, working your hands lower, stepping your feet out further from the wall. Again, ideally you have a wall, the post, it's a small target. Now, that will be easy for some people. And if that's you, then you can mess around with actual back bridge. So we'll see how these are feeling today. You can try these with a bench actually. Tension, bum tight, hips up. Set your hands and push up. So I can tell that, and I get this sometimes. My shoulders aren't where they need to be to go into that full lockout. If I was actually going through this, and you'll learn how to do this over time, I would feel that and then think, okay, if I want to troubleshoot for 5 minutes, I'm going to work on the shoulders. I would do something like Cuban rotations, and then I would be able to access that. Again, you will be different. You'll learn over time how to troubleshoot. That's the beauty of this. You'll be able to almost self-diagnose yourself. Now you can also do this with feet elevated. I really like that, but you do have to have more shoulder strength to do that. But the nice thing is it's a bit more manageable if you have a tight lumbar spine, like I do. I'm still working on it. And then you want to pair that. This is the last exercise. We pair that. That's extension. We pair that with spine flexion. And for this, interlock your hands. And then all you're going to do is come forward so you get a nice stretch in your low back. And then push your knees to the floor. So we're just doing the opposite of what we just did. And that's our introduction to the back bridge.